All right. Well, I want to welcome you all and say hello to everyone, both near and far, right now and in the future, who's joined our conference on ending student homelessness. I'm Ann Maston. I'm a professor here at the University of Minnesota, and I co-direct the Homework Starts with Home Research Partnership together with Professor Hanratty, who's here beside me from the Humphrey School of Public Affairs, and Eric Grumdahl, who's Deputy Director of the Minnesota Interagency Council on Homelessness. Our partnership is a grand challenge project that aims to address the issue of student homelessness by integrating and analyzing data collaboratively. It's a research practice partnership funded under the umbrella of the University Grand Challenge area of fostering just and equitable communities. In that context, we believe it's especially important to acknowledge that our university stands on the homelands of the Dakota people, the first people of Minnesota, Makoche, and we also acknowledge slavery's deep roots in this country. We recognize that American Indian peoples and nations and the captive and free African Americans of this land during our history have played a vital role in building this country. We encourage everyone to consider this history as you contemplate the issue of homelessness in the context of equity and justice and actions to address student homelessness in the future. In Minnesota, student homelessness affects a far higher proportion of American Indian and African American students. We hoped that we would be presenting this conference in person, so we're disappointed to be coming to you virtually. However, this topic is so important and timely that we remained committed to convening this, albeit virtually. We're grateful to be able to share most of our planned conference through this Run the World platform. We are new to this tool, and I imagine many of you are as well. So if you notice some hiccups, I hope you will appreciate the resilience and hang in there. A couple of things to know about Run the World. Your original ticket has email contacts for getting help if something goes awry. We also have posted this information in the early chat comments in this session. I think it's about 9 chats from the top from Misty Blue with information about how to get some help if needed. Some aspects of our conference were pre-recorded for logistical reasons. This makes it possible for our speakers who are live online to monitor and respond to questions posted in the chat as their talk is proceeding. You can also enlarge the recordings we will be playing to full screen size, which I highly recommend. But please note that when someone is showing live PowerPoint slides, they cannot be enlarged. There are 2 ways to ask a question. First, you can ask a question in the chat stream at any time. Or the second way is by requesting the mic, which you can do during the live Q&A times. There are multiple sessions and also some breaks, as you can see on the main homepage of the meeting. During the final time slot from 2:30 to 3:30 Central Time, there are 2 breakout sessions running simultaneously that you can choose from. This morning, we have a keynote address from a highly influential researcher, Dr. Beth Shinn, which was recorded, but as you can see, Beth is right here. She will watch for questions during the presentation, and then afterwards, we will have time for live questions from the audience. Attendees during that live session, as I mentioned, can request the mic during the live Q&A to ask a question. You will find the button for requesting the mic on the bar at the bottom of your screen near the emojis. Following the keynote session, there is a live panel with diverse perspectives to reflect on the keynote and also tell you what their agencies are doing to address homelessness. I personally am eager for an update from these folks on the impact of the pandemic on students experiencing homelessness. After a short break, we will then resume with a session on the goals and progress of our Grand Challenge Research Partnership. Our team is going to highlight what we've been up to and report on the initial findings. We're excited to have 6 of our original cohort of graduate and postdoctoral fellows taking part in this session, with 5 of them presenting data in brief flash talks. Financial support for this research was provided by the University of Minnesota Grand Challenges Research Initiative, through the Office of the Executive Vice President and Provost here at the university. The project was also supported in part by the University Metropolitan Consortium and a grant from the Children and Family Services Division of the Minnesota Department of Human Services. Finally, I'd like to extend our deep appreciation to Misty Blue, our project coordinator, for organizing this conference during these trying times. And now I'd like to turn the mic over to Maria Hanratty, who's a professor in the School of Public Affairs at the Humphrey Institute and also co-director of our Grand Challenge project, to introduce our first keynote speaker. It's all yours, Maria.
Great. Okay, thanks, Anne. I'm very pleased to introduce our keynote speaker, Dr. Marybeth Shinn. And Dr. Shinn is a Cornelius Vanderbilt professor at Vanderbilt University who studies how to prevent and end homelessness. And I'd really like to personally thank Marybeth Shinn for a terrific work, which has helped us to move forward in our understanding of how to address homelessness. Beth Shinn was the co-PI on the Family Option Study, which is, to my knowledge, the first large-scale randomized experiment that tests housing approaches to ending family homelessness. She was the evaluator on the initial study of the Pathways Housing First program in New York City, which is the precursor of many of today's Housing First programs. She has also thought deeply about how to target prevention services and has developed a model which is now used in New York City to target its homelessness prevention services. We're all fortunate that Beth Shinn and her co-author, Jill Kaduri, have recently published a book titled In the Midst of Plenty, Homelessness and What to Do About It. I had the pleasure of reading this book prior to the conference, and I found it to be very useful, both because it's based on such a solid body of research, and also because it does such a good job of integrating what she and other scholars have learned to provide directions for policies to prevent and end homelessness. So with that, we're going to now play the pre-recorded talk from Beth Shinn. And as Anne mentioned, if you have questions or comments, you can enter them in the chat box during the talk, or you can request the mic when we have the Q&A session afterwards.
It's a pleasure to join you here today to talk about homelessness among families and what to do about it. Colleagues at the University of Minnesota and elsewhere have done wonderful work on how to help children who are facing homelessness to thrive. My focus is further upstream. I'm going to talk about how we can stop families becoming homeless in the first place. I will try to answer 4 questions. Who becomes homeless? What causes homelessness? How do we end family homelessness? And how do we prevent it? We have most evidence for the kinds of homelessness tracked by the Department of Housing and Urban Development. That is, people who are in homeless shelters, like the one pictured, and people who are completely unsheltered. But I think the evidence applies to broader forms of homelessness as well. The first question is, who becomes homeless? Over 500,000 people are staying in shelters in transitional housing programs, or are found in street counts on a single night in January. And we know that we miss people. The Department of Housing and Urban Development counts these 2 groups, sometimes called literally homeless, because their focus is getting housing services to the people who are worst off. But many more people experience homelessness over longer periods and by different definitions. Over the course of a year, over 1.4 million people stay in shelters. 500,000 of them do so as part of families, with at least one adult and at least one minor child. The Department of Education has a broader definition because their focus is getting educational services to school children. DOE includes children in families staying in hotels or doubled up with other households in the same dwelling unit. Schools report that 1.5 million school-age children are homeless over the course of a year by this definition. Again, we suspect people are missed because families may not notify schools when they experience homelessness. It turns out that the way to get the largest estimates of homelessness is with telephone surveys. Back in 1990, early in the current epidemic of homelessness, a telephone survey of people living in regular housing, no homeless shelters or barracks or mental hospitals or jails, found that 7% of adults said that they had been literally homeless at some point in their lives, and twice that many if we count doubling up. So most homelessness is a temporary state that people pass through. That gives us many points of intervention. How do we prevent homelessness? How do we help people escape it? How do we stop generating more? By HUD's reckoning, on a single night, there are roughly equal numbers of individuals without children who are sheltered, individuals who are unsheltered, and families, most of whom, thankfully, are sheltered. Some of the individuals are parents who have been separated from minor children. By the Department of Education's reckoning, 3/4 of homeless students are doubled up. 12% are in shelters, transitional housing, or awaiting foster care, and 7% each are unsheltered or in hotels. The numbers by these two systems of reckoning are not fully compatible, even where they presumably overlap. Both agree that a relatively small, although particularly troubling portion, are unaccompanied children, who may be in any of these categories. By the DOE reckoning, they make up 8.6%. By the HUD reckoning, unaccompanied children under the age of 18 make up 3.7% of all sheltered and unsheltered children. HUD reserves the term youth for 18 to 24-year-olds. But note that DOE does not include children who are too young to attend school. And children who experience literal homelessness are young. As this graph shows, infancy is the age at which an American is most likely to stay in a homeless shelter. Children are a blessing, but require food and cribs and other furnishings, and they outgrow their clothes every time you turn around. Most importantly, they require the parent either to pay for costly care or to stay home to provide that care. Rates of shelter use stay high in the preschool years and drop when children reach school age and childcare expenses drop. Homelessness rises again in early adulthood, when some of those young adults become parents. So when we think about the face of homelessness in America, we should think not just about the man on the left, but about the child on the right. The families who are captured by the two definitions of homelessness are not that different. 3/5 of those who become literally homeless are leaving doubled-up situations. And in one national study that followed families recruited in homeless shelters over time, 3/10 of families who received the usual services available in their communities were doubled up 3 years later. Most research about preventing and ending homelessness uses the HUD definition, but probably applies to families who are doubled up as well. There's one more important thing to know about people who become homeless. People who face racism and other forms of social exclusion are particularly vulnerable. African Americans and Native Americans have disproportionately high rates of homelessness, even among people who are poor. Other forms of social exclusion matter for other groups. For example, people with disabilities. LGBTQ youth are more likely to become homeless than heterosexual youth, largely because of exclusion by their parents. But racism is probably the most important form of social exclusion affecting families. Now let's talk about the causes of homelessness. We have 3 powerful pieces of evidence that what caused the current epidemic of homelessness is a housing affordability crisis. What I mean by the current epidemic is the homelessness that began to be apparent in the early 1980s and continues today. One piece of evidence comes from history. What was going on when the current epidemic of homelessness started? Another piece of evidence is from geography, where rates of homelessness are highest. The third piece of evidence is from what we know prevents homelessness. This slide shows that in 1970, there was a small surplus in the number of housing units that people at the bottom of the income distribution could afford, by the standard that households should spend no more than 30% of their incomes on rent. And we had very little homelessness. That may be hard to imagine. Young people today have had to pick their way around their fellow citizens on the streets throughout their lives, and older people can scarcely recapture their shocked disbelief at the rise in homelessness. Indeed, in the 1960s, social scientists thought that homelessness was at an end. It was largely confined to older men in skid rows. One book at the time was entitled "Old Men, Drunk and Sober." Researchers thought that when that generation passed, so would homelessness. But that's not what happened. Income inequality increased. Many low-cost housing units were replaced by luxury dwellings. Rental costs grew, and incomes at the bottom of the distribution did not keep up. Poverty was already high in the United States compared to other industrialized countries, particularly so for families, and poverty became deeper. Thus, that surplus of affordable units turned into a larger and larger deficit. In the 1980s, the New York Times ran an editorial series called New Calcutta. Wags complained with some justice that the Times was unfair to Calcutta, but the point of the metaphor was clear. How, the Times asked, could such abject poverty be permitted in a wealthy land? Over the 1980s and 90s, people began to spend more and more of their incomes on rent. And when that did not suffice, they doubled up with family and friends. When those arrangements broke down, they took to shelters and the streets. Modern homelessness arose, first among younger men, racial minorities, women, and then families. This map shows what a full-time, year-round earner's hourly wage would have to be in order to afford the fair market rent. That is, rent at about the middle of the market for a 2-bedroom apartment. Affording here again means paying only 30% of one's income on housing. Minnesota is in about the middle of the states, where the hourly wage needed to afford a modest 2-bedroom apartment is just under $20 on average. Some states are better, others are worse. But there isn't any state or even any county in the United States where a family with one full-time minimum wage earner would be able to afford the rent. Of course, statewide averages are oversimplifications. Rents are different in Minneapolis and in, say, St. Cloud. This figure illustrates the relationship between housing costs and high rates of literal homelessness. It shows the largest 25 metro areas in the United States. The left axis is the rate of literal homelessness, the point-in-time count divided by the total population. The bottom axis is median rents. You can see a clear relationship here. Homelessness is higher in places with particularly high rents. Those metro areas are affluent in some ways, but because of the high levels of inequality, there are also many people who cannot afford the high rents. I've bolded Minneapolis here, in the middle of the lower pack. This is the first piece of evidence that homelessness is fundamentally a housing affordability crisis. This is the final piece of evidence. A housing choice voucher is a rental subsidy that holds a family's housing costs to 30% of their income. A rigorous experimental study showed that providing those housing vouchers to poor families who were receiving welfare wiped out the risk of homelessness. I'll provide more evidence later about using vouchers to get families who are already homeless back into housing. How does social exclusion work to put some families at greater risk of homelessness than others? We have the most evidence for African Americans, where 4 forms of social exclusion in incomes, wealth, housing, and incarceration seem particularly important. The first form of discrimination is in jobs and incomes. In 2018, black men earned 3/4 as much as whites. Black women earned 4/5 as much. For the past 3 decades, unemployment has been roughly twice as high for blacks. This is not a difference in skills and experience. A paired testing study had people with the same education and experience answer job ads, but use different names identifiable as African American or not. The study measured differences by the person's apparent race and being called in for an interview. The difference between being Lakeisha and being Emily was the equivalent of an 8-year difference in experience. Wealth disparities are much starker than income disparities. The median white family has 13 times the assets of the median black family. And even a black household with a college degree has less wealth on average than a white household with less than a high school diploma. Because for poor people, most wealth is tied up in housing, black families are more likely than white families to experience housing crises, and less likely to have a relative or friend able to provide housing help. These wealth disparities didn't just happen. They result from a long history of governmental as well as private discrimination. The federal government segregated public housing, with black families shunted to inferior housing projects. The Federal Housing Administration refused to insure loans to black homebuyers, or even whites in integrated areas where blacks also lived. The color-coded maps, like the one shown, used by the Federal Housing Administration to deny loans in so-called risky areas, are the origin of the term redlining. Thus, black families were unable to benefit from the accumulation of housing wealth following World War II, but white families were able to pass on from generation to generation. Urban renewal often cleared out neighborhoods where blacks lived, and highways cut through black neighborhoods or cut them off from areas with better jobs. And paired tests that measure housing discrimination by sending similarly situated black and white renters or buyers to visit the same housing units show that discrimination continues today, despite the fact that it has been illegal since the late 1960s. And then there are the disparities in rates of incarceration that were exacerbated by the so-called war on drugs, and the much greater likelihood that people of color would be incarcerated as a result of minor drug charges. Incarceration takes fathers out of families and earners out of communities. Incomes are affected even after a person is released. So those are the causes of homelessness: a housing affordability crisis that is particularly hard to cope with for people that also live with the results of social exclusion. Let's turn now to how to end homelessness. Here we have evidence of programs that work for particular groups, and also about the impact of broader systems change. The 12-site Family Options experiment compared different interventions for families recruited in homeless shelters. It showed that offering families housing vouchers that reduced rental costs to 30% of their incomes not only reduced every measure of homelessness and residential instability, including doubling up, but also had radiating impacts. It reduced separations of children from their parents, children's school moves, absenteeism, and behavior problems. It reduced family food insecurity. For adults, it reduced domestic violence, psychological distress, and substance abuse. That is, vouchers reduce some of the individual problems that can sometimes lead to homelessness, and provided a platform for families to solve other problems on their own. As one mom in the study put it, "For me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full-time and so am I. We know we're supported and we don't have to worry about losing the house because we're trying to go to school and work, and we're safe and we're okay, and we'll get things back on track." Further, few families were ineligible for the vouchers. Lease-up rates were high, and all these benefits cost only about 9% more than usual care in the communities that we studied. Black families were just as successful as white families in using and retaining vouchers, so vouchers can help to overcome some of the problems of social exclusion. The success of housing vouchers in ending homelessness provides additional support for the theory that homelessness is, at its core, a housing affordability problem. Housing choice vouchers are open-ended. Families can renew them as long as they remain eligible by reason of income, with the value of the voucher gradually shrinking as household income increases. An alternative intervention we tested in the Family Options experiment was shorter-term, rapid rehousing subsidies. Here the theory is that homelessness is a short-term crisis, and the goal should be to help families get beyond the crisis and back into housing as quickly as possible. Subsidies lasted 8 months on average. Take-up of the program was low. Altogether, fewer than 3/5 of families offered rapid rehousing used it. Families were given referrals to specific programs that had reserved slots for them, yet 2/5 did not show up. As one mom put it, "Okay, we get out of shelter, find a place for who knows really how long, and then what? Wind up back in shelter? It seems kind of counterproductive to me. Although I appreciate the help, certainly, but ultimately it seems kind of failed in that aspect. Because if by the end of the year I don't have a way, where do we go from there? Everything seems to be closed." If there was an effect of rapid rehousing subsidies on housing stability, we missed it by the time we went back for our first follow-up 20 months after families entered the study. There were scattered effects on other outcomes that could be consistent with chance. The main selling point for rapid rehousing is cost. It's no worse than usual care and cheaper, so on that ground should be preferred. But it doesn't do much to end homelessness. In Family Options, we randomly assigned a third group of families to offers of transitional programs where families live in supervised settings and are given extensive psychosocial services. Until recently, these programs, along with shelters, were the mainstay of the homeless service system. But although they are designed to serve families experiencing homelessness, they screened out far more families than did the public housing authorities that administer housing vouchers, and take-up by families was low. Families could stay up to 24 months, so transitional housing had modest effects on use of homeless shelters during the period that families were in the transitional housing programs. You can't be in 2 places at once. But the offer of transitional housing did not affect doubling up. The theory behind transitional housing is that families need to address the problems that brought them to homelessness, or that are consequences of the homeless experience, with psychosocial services before they can flourish independently. This approach is sometimes called services first, in contrast to housing first. The Family Option study provided no evidence for this theory. There were no benefits of transitional housing for psychosocial outcomes, child welfare, or self-sufficiency, and the programs cost slightly more than usual care. Transitional housing may be of some benefit for groups that are really transitioning, such as youth aging out of foster care. But we did not study these groups, and we found no evidence of benefits for families. There is also evidence that not just specific programs like housing choice vouchers work, but also that focused systemic efforts accompanied by resources can end homelessness for different groups. The country cut veteran homelessness nearly in half, with the combined efforts of the Veterans Administration, the Department of Housing and Urban Development, and state and local governments. Veterans were targeted with special supportive housing vouchers and other rental subsidies. The VA screened veterans who came in for medical services for risk of homelessness and referred those that screened positive for additional services. Cities put veterans at the head of their lists for housing. The U.S. also reduced chronic homelessness by increasing the supply and targeting of permanent supportive housing. When we put our mind to it and add resources, it makes a difference. Families have not been the focus of these coordinated national efforts. Other countries have done better. As the graph shows, Finland has largely ended literal homelessness with a concerted Housing First approach. Housing First gets people into housing immediately without prerequisites, instead of trying to make them ready for housing via transitional programs. Note that the light blue bars here, institutional placements, would not even be counted in U.S. figures. The dark purple bars at the top are families. So few families are homeless in Finland that the official statistics don't break out the different forms of homelessness, and for families, doubled up is included here. Finland has not yet met its goal of ending doubled up homelessness, and that is the target of its next phase of efforts. The evidence is strong that we can end homelessness for people who experience it, but we also need to prevent homelessness for people on the brink and to stop generating homelessness. Prevention programs are difficult to design well because it's hard to tell who would have become homeless in the absence of the intervention. Getting services to people who will benefit most is a major challenge. It's not enough for a provider to say, 90% of the people who got my program remained housed. I can tell you how to get to 100%. Just give your services to millionaires. So bad targeting can masquerade as effective prevention programming. Every study that has looked finds that you get the most impact by focusing on people with the highest needs, even if you have the most failures there. Here's an example. New York City has a prevention program called Home Base, which consists, essentially, of good old-fashioned social work backed up by some cash resources. Workers make sure that families are signed up for all the benefits they're entitled to. They can try to mediate problems with landlords or primary tenants with whom a family is living. They can offer help with education or job placements or childcare or financial counseling. And they can provide short-term financial assistance. The program is funded by the city and delivered by nonprofits rooted in their communities. There's experimental and quasi-experimental evidence that it works modestly. But as when anything of potential value is on offer, people will line up to get it. The question is, who should be served? For the next few years, or for the first few years, workers interviewed applicants and then decided whom to serve. The city provided me with that intake data and actual shelter entries over the next 3 years for 11,000 families. We used Cox proportional hazard analysis to develop a risk model that the city continues to use to decide whom to serve. The next question was whether services should go to households at highest risk, or whether some households were too risky to serve. In the latter case, a model of triage, as adopted by doctors on the battlefield, would reserve services for people in the middle. If triage was the right model, there would be some families at low risk who were unlikely to go to shelter, whether or not they got services, and others at such high risk that they would enter shelters no matter what was done. These are the data. The bottom axis shows relative risk of shelter entry, with families divided into 10 equal groups. The left axis shows the proportion of families who entered shelter. The top dashed line shows shelter entry at each level of risk for families whom workers, left to their own devices, declined to serve. The bottom solid line shows shelter entry for families workers deemed eligible for services. The difference between these lines is one measure of impact. There was indeed a low-risk group unlikely to go to shelter, whether or not they received services. But impact was highest where risk was highest, even though the failure rate was also highest for the highest risk households. The help on offer here was much more modest than an ongoing rental subsidy, so that the results were also modest. But even this fairly modest program made the most difference for people at highest risk. As we will see, that finding is consistent across every prevention study that is looked. Why did workers deem some high-risk families ineligible for services? It turned out that in comparison to the model based on the data, workers erred in giving services to people who might be called the worthy poor. They were more likely to give services to high school graduates, but people who had not graduated from high school were at higher risk. They were more likely to give services to people who were employed, but people who were unemployed were at higher risk. In targeting prevention services, we need to decide whether we want to reward worthiness or to end homelessness. Let me summarize the strong evidence that a few prevention strategies work. As I noted earlier, there's experimental evidence that the same housing vouchers that end homelessness also prevent it for poor families. The highest risk families, those where the household head was unemployed, and those whose public assistance was about to run out, benefited most. In the case of New York City's home-based program, we just saw that families at highest risk benefited most. The last program with strong evidence of success is cash help for eviction prevention. Most people who get evicted do not go on to become literally homeless. In one rigorous study in Chicago, only about 2% of those who called an eviction hotline for help became homeless and entered shelter in the next 6 months. But as that study showed, cash help reduced the percentage much further. Like most programs to help families faced with eviction, the Chicago program required people to be worthy. Families had to show that their financial crunch stemmed from an eligible crisis, such as job loss or a medical emergency, rather than enduring poverty. And they had to show that they'd be able to sustain the rent once the crisis had passed. So services did not go to the highest risk families, but among the families served, effects were strongest for the poorest families, those with incomes below 90% of the poverty line. Very few people with higher incomes became homeless, whether they got help or not. There's weaker evidence for some additional approaches. Legal help reduces evictions, but we don't know that it also reduces homelessness. Ongoing rental subsidies, more modest than those provided by housing choice vouchers, prevented homelessness among people with HIV in one study. Modest ongoing subsidies haven't been studied for families, only short-term subsidies of the sort provided by rapid rehousing programs. And universal screening for prevention was part of the full-court press that reduced homelessness for veterans. There are a number of other prevention programs for both families and for other groups that may work well, but we don't have enough research to know for sure. This is a fruitful area for additional study. In addition to helping people on the brink of homelessness, we need to change the broader societal conditions that are the cause of homelessness. I showed earlier that most homelessness is temporary. Although we have strong evidence on how to end it for people who experience it, and we have some evidence about how to prevent it for people at high risk, we will never put an end to homelessness unless we stop generating it. And we have pretty good ideas about how to do that. Because housing affordability depends on the gap between housing costs and incomes, anything that reduces housing costs or raises incomes at the bottom of the distribution will help. We also need to combat social exclusion. Let's talk first about reducing housing costs. The most powerful thing we can do, the closest thing we have to a silver bullet to end family homelessness, is to expand the Housing Choice Voucher Program. The program has increased only from 2 million to 2.2 million households in the last 20 years. Thus, only about a quarter of households who are eligible for vouchers by reason of income receive them. Waiting lists are long, or even closed, in most jurisdictions. Adding about 300,000 units a year nationally and focusing on the poorest renters would both prevent and end much homelessness. The Bipartisan Policy Center estimated that a scaled-up program to provide vouchers to all eligible households that would use them would cost about $31 billion per year. Some areas of the country also need to work on expanding the supply of rental housing. That could be done by expanding the National Housing Trust, along with local efforts, like affordable housing funds. But if we want to end homelessness, it's important to focus on the poorest renters, those with incomes below 30% of the local area median income. That's approximately equivalent to the poverty line, with variation from place to place. But many affordable housing funds extend to households at 60% or even 120% of area median income. People with those higher incomes may still be struggling, but they aren't as likely to become homeless as poorer people. Another way of increasing supply is to make it cheaper to produce units by overturning exclusionary zoning. For example, reducing barriers to producing multifamily housing and reducing barriers to subdividing existing housing units. Minneapolis is doing a great job here. The housing affordability gap can also be closed by increasing incomes and strengthening the income side of the safety net. For example, evidence shows that there's plenty of room to raise the minimum wage without a negative effect on the supply of jobs. The Earned Income Tax Credit works well for those able to work by augmenting family incomes for each dollar earned, up to a limit. The Temporary Aid to Needy Families program provides families with time-limited income, but many families who are eligible are not enrolled. SNAP, also known as food stamps, reduces costs that compete with rent. SSI and SSDI disability income support could be raised to levels that make housing affordable, or require only a small rent subsidy to make housing affordable for people with disabilities. In the Family Option Study, among the third of families who reported a disabled member, those who secured disability benefits were more likely to stay housed. More widely available, low-cost childcare would reduce a major barrier to working for families at risk of homelessness. Childcare and paid family leave might keep infants and preschool children out of shelters. Income volatility is also an issue. We've all seen the effects of income loss in the current COVID crisis. Augmenting unemployment insurance and getting it to people quickly would help. Expanding Medicaid in states that have not done so would reduce the role of health crises in income volatility. The housing and income strategies I've discussed trade off with one another. For example, if incomes are increased sufficiently, then fewer housing vouchers will be needed. But the gap is large enough that we probably need an all-of-the-above approach. Raising incomes and reducing housing costs would go a long way toward preventing homelessness by closing the housing affordability gap. But we also need to work directly on social exclusion. We have evidence that housing choice vouchers work better. That is, more people succeed in using them to find housing units in places that prohibit landlords from refusing to rent to a household simply because the household will be using a voucher to pay part of the rent. An increasing number of states and cities are enacting such laws, but it would be good to have a national law. It took HUD 50 years to issue a rule to enforce the requirement of the 1968 Civil Rights Law that communities create a plan to identify and dismantle barriers to fair housing on the basis of race, disability, and other categories. And then the current administration quickly put that new rule on hold. We also need better enforcement of the national fair housing laws that are already on the books. We do a much better job of monitoring ongoing illegal discrimination than of enforcing the law. In summary, we know how to end family homelessness. We know what causes it. We know how to help people leave it. We have pretty good evidence about how to prevent it for people on the brink and how to stop generating it. What it takes is political will. Homelessness is a choice, not by people living on the streets or doubled up with other households, but by the rest of us when we turn the other way. If you're interested in reading the research behind the arguments I've made here, my colleague Jill Kaduri and I have summarized it, including research about single adults as well as families, in a recent book called In the Midst of Plenty: Homelessness and What to Do About It. Our central message, as in this talk, is that we know how to end homelessness, and our country has the resources to do it. Finland is not as wealthy as the United States, but they've chosen to end homelessness. We could as well.
Thank you, Beth, for such a very illuminating talk. And I'd like to open up the floor to people who might have questions. If you have questions, could you please put them in the request the mic.
Mm-hmm. And I should say I tried to answer a few questions in the chat and discovered that I'm way too long-winded for Run the World, so that I had to divide messages up and sometimes say less than I might otherwise have, except that Run the World kind of enforces being a little succinct.
Is there something else you'd like to add in there, Beth?
I think I tried to get it done. I mean, one of the interesting questions there that I may not have answered clearly enough was, is there a group that benefits more from, say, transitional housing? And the suggestion there was young people. And there are a gazillion things that you could try to say, what works better than something else. Maybe people who are left-handed do better. And so we put our money on two indices to try to say what might enable some interventions to work better than others. One was an index of psychosocial issues, problems, and that included things like domestic violence and substance abuse and psychological distress and having a family member with a disability. And the second index that we tried was one of housing barriers, and that was things like having an eviction history, not having a rental history, not having money for rent, having past rental arrears. And so we looked at whether the interventions, all of them, worked differentially well for folks who were high and low in psychosocial issues, and whether they worked differentially well for folks who are high and low in housing barriers. And we didn't find anything. Now, for the data geeks among us, we didn't have a lot of statistical power to do those tests. So we can't definitively say, it works for everybody equally. On the other hand, we don't have any evidence of differential effects. We didn't try younger and older.
Thank you.
You can see why Run the World cut me off.
Yeah, exactly. Any other questions from the audience? I have a question to get us started. So one of the things our grand challenge is doing is it's integrating data from the school systems with the homeless system. And there's a lot of really interesting things that have come up with us. One is just that the two systems don't really talk that well together, and they use different indicators and different metrics and different goals. And I'm just wondering if we integrated the two systems together. First of all, what do you think would happen to research? Would we have different evaluations of the comparative benefits of different programs? And secondly, what might that do for policy?
Mm-hmm. Well, I think that's really interesting. And there are jurisdictions that have done a nice job of integrating systems level data, mostly not with education, mostly other systems. So Los Angeles is a model of trying to integrate all kinds of systems, and Philadelphia has done pretty well as well, but I don't think either of them have brought in education. There are, of course, these different definitions of what constitutes homelessness. And for people who missed the beginning of the talk, it's because HUD is trying to get housing resources to the people who are worst off in terms of housing, and the education system is trying to figure out what works for kids who are facing various forms of residential instability, and so they want to cast a broader net. So I think it would be really interesting to see to what extent homeless interventions work for the kinds of homelessness that the school systems measure. In family options, we did have a measure of doubling up, and the interventions that, the housing choice vouchers reduced doubling up, and rapid rehousing and transitional housing did not reduce doubling up. So I think probably we'd find the same kinds of things, but I don't know. The one group that the school data misses that educators should be really concerned about are young kids. And so that might be very helpful because, the literally homeless families are young. They have young children. It's not so much that the parents are young, it's that the children are young. And so those are children that schools should be hugely concerned with. They are going to be their students in a few years. And it seems likely that those really early kinds of experiences would be important. But so that could be an interesting kind of consequence of joining up the systems.
Okay, thank you very much. Any other questions?
So, Beth, I'm wondering if you have any recommendations about how we do the best work we possibly can to support families who are child welfare involved. And I think about that two ways. One being, families with young kids who may or may not have kids in out-of-home care, but then also those kind of older young adults who perhaps were in extended foster care.
Mm-hmm. There's a huge overlap between the homeless service system and the child welfare system, as those of you who work in either know. I've got kind of several answers that circle around the question. One is that some of that involvement is post-homelessness. That is, we did one study in Alameda County, California, where we looked over time at involvement in the homeless service system and in the child welfare system. And we found that for African American families, but not white families, becoming homeless led to a whole bunch of unsubstantiated referrals to child welfare. Didn't lead to more substantiations. It led to a lot of unsubstantiated referrals. So partly the good news is the child welfare system was doing its job and it wasn't differentially coming down on Black families in Oakland and the rest of Alameda County. But the troubling thing is that there were all these unsubstantiated reports, which may be cultural differences in parenting. it's really not clear entirely why, but we are guessing that some of those reports actually came out of the homeless service system. So, I'm a parent. I'm not happy with everything I've ever done with my children. I'm sure that there's no parent that thinks they've been an ideal parent 100% of the time. But if you're in a homeless shelter or worse on the streets, you're parenting in public. Everything you do is under the scrutiny of well-meaning social service providers who are concerned about the kids, but who aren't cutting families a lot of slack, and they're not cutting Black families a lot of slack. And even if that report is unsubstantiated, it's still hanging there in your records. And if at some later point there's another report, oh, well, that's the second. And so it really puts families at greater risk. There's a study that is the coordinating centers at the Urban Institute that looks at whether supported housing is a good intervention for families who are at the nexus of the homeless service system and the child welfare system. And the results are clear that it improves families' housing stability. You give people supported housing, it's like giving people a housing voucher, you get greater housing stability. But it's not as clear that there are benefits for child welfare outcomes. In one of the sites, it looked like there were more referrals under those circumstances and more family separations. In some other sites, it looked like it was better. Overall, maybe modestly better for the families. So I think this is a fruitful area for work. Then the other group you're talking about are young people aging out of foster care. And that's a group where we really need some more research, and some of it's going on, particularly out of Chicago. I'm blocking on the name of the center there. But it looks as though extended age foster care, that is, states are allowed to extend the age at which they support young people up to 21 rather than cutting them off at 18, postpones homelessness rather than ending it. So people are less likely to become homeless in that interim year, but they do a little bit later. The risk from being in foster care extends for a decade. It's probably because those young people don't have the familial resources to fall back on. My kids graduated from college, they're now 21, 22, and they came back home until they got on their feet. And the children who've been in foster care, young people don't have homes to go back to in that same way. So I think that's a really important issue. Whether the same interventions work really well for young people who don't have children, who are, single adults, we don't know. For young people who do have children, I would still at this point put my money on the housing choice vouchers, though we haven't looked specifically at that age group. And now there are a bunch of questions in chat that I haven't been able to read while I've been blabbering on.
Let me read one of them to you. From Christine Ma. The Family Options Study demonstrates powerful evidence for the benefit of the HCV, but many jurisdictions say it's too costly and they don't fund it adequately, and therefore they put funds into housing shown to be of less benefit. How would you recommend responding to this?
Okay, so there aren't enough housing choice vouchers. Only about 1 in 4 families that's eligible for them get them. And that's a federal issue. That is, we really need to expand the size of that program. It's, as I said in the talk, it's expanded from 2 million to 2.2 million units over 20 years. So we could expand that program. The benefits were great, and over a 37-month period, the cost was only 9% more than usual care. Now, usual care is not nothing. In our 12 communities, it was $41,000 per family over 37 months, and about a third of the families got some form of housing subsidy, not necessarily housing choice vouchers. It might have been public housing, it might have been supported housing, but some form of housing subsidy by the 37-month point. So we're saying, giving it to folks right away costs a little bit more and has enormous benefits. So should we do it? It's a matter of political will. Should we also test interventions like somewhat less valuable housing subsidies that might be ongoing? I think that would be a fruitful area for additional research. But we don't have good studies there.
Great, thank you. Do you want to address Eric Rumdahl's question?
I'm scrolling. Eric, implications for COVID-19?
Yes.
Yeah, COVID-19 is, it's a problem on so many dimensions, and it hits differentially the same folks, African American, Native Americans, also Latinx peoples that have been hit by the general homelessness crisis. I think one thing you want to do is to try to use CARES funds in communities to get temporary subsidies to people who are currently homeless and bridge those to permanent subsidies, bridge those to housing choice vouchers, because the waiting lists are so long that people who are currently homeless are not going to get typically a housing choice voucher right away. But there is money in the CARES fund that can be used for temporary subsidies. In terms of kind of longer term, as I said in the chat earlier, homelessness is what's known as a lagging indicator. So you don't tend to see, it's not the first thing that happens to somebody. Families use up all of their resources. If they get evicted, they try to move in someplace else. There'll be a lot of vacant apartments if people are getting evicted. Then they'll move in with their family and friends, and it's only down the road that they become literally homeless. Now, moving in with families and friends is homeless by the Department of Education definition. So I'm expecting we are going to see a major increase in homelessness if we don't manage to deal with it with help from Congress and the federal government. It's unprecedented. I mean, we might be looking at the Hoover bills of the Great Depression again.
Are there other questions from the audience?
We have one from Casey. Have you seen any evidence to support prioritizing families with 0 to 3-year-olds for housing versus others? Not even sure if this is even a possibility, but something that has been raised from a policy perspective.
Mm-hmm. I think it would be a good idea, but I haven't seen evidence for it, or I haven't seen people trying it, at least in a way that they're measuring the effects. So I think it would be certainly worth looking at. I would support it as a local initiative. I think what is clear is we want to target housing choice vouchers to people who are poor. They can go to people up to 50% of area median. The low-income housing tax credit can go up to 60%. Many affordable housing funds go up to 120% of area median. It's the folks that are the poorest that are becoming homeless. So in family options, the median annual income of families that we recruited in homeless shelters across 12 sites was $7,400. I mean, just way, way below the poverty line. And so I would probably set priorities on the basis of household poverty. And then, for the youngest children, the issue is the parent either is paying for childcare or is out of the workforce. So if we could get good childcare, that would also help those young families.
That's a great question.
And then do we have time for one more, Maria?
I think so. Yeah, let's do one more.
Okay, Vicki said, have you heard of communities that are promoting your citizens to invite foster children who have aged out of the system to live together? benefiting both the senior and the foster child? If you
Great
have,
idea.
how is it working? Yeah.
Great idea, but I haven't heard of it.
Great.
Worth trying and studying.
Okay. Maybe we do have time for one more question. There's a question that says that the HUD definition of homelessness leaves out a lot of children in the point in time count. And
Yep.
so how do you do advocacy in that situation when most of your homelessness occurs in doubled up rather than shelters?
So, that's a debate. And folks like the National Alliance to End Homelessness say, don't expand the definition. You're then, unless you're expanding the resources, you're spreading the same resources over a somewhat less needy group as well as the neediest group. Education folks say, of course, those kids are really needy and we need to get special services to them. I think we need to expand the pod.
Okay, great. Thank you. Well, anyway, I think we're just about out of time. So I'd like to thank Marybeth Shinn and the audience for your insightful presentation and discussion. And just let you know, the next session, Ending Family Homelessness, Reflect and Connect, will start immediately after the session, and it'll go from 9:45 to 10:30. And in this session, we're going to hear from local Minnesota policy leaders who are working to end homelessness, who will reflect on Beth Shinn's talk, and then also she will reflect back. So if you'd like to attend this session, you should navigate back to the Run the World conference page and log on to the next session. So thank you, everybody.
Yeah, and thank you very much for listening, responding, for your questions. Appreciate it.
Okay, thanks a lot.